So, good morning, everyone. Bonjour tout le monde. So, welcome to the very first session for today for the pre-conference sessions of the Canadian Science Policy Conference 2022. And our panel today that will start off our symposium is Breaking Down Barriers and Improving Outcomes Towards an Integrative and Inclusive Session for Mental Health. And before we get started, first of all, I would like to acknowledge that I am speaking to you from the ancestral and unceded territory of the Algonquin and Anishinaabe people, and we very much are appreciative of their rights here and their importance to our Canadian sessions. So we have a really fantastic program lined up for you. We're hoping that we'll see lots of interaction, because if anything, mental health is something that I think all of us can either experienced ourselves or are very familiar with. It cuts very close, I think, both intellectually but also quite emotionally to many of us. So what I would like to do today, just to walk you through how the session will go, is that after I speak, we will have introductions from some experts that we brought on, and I'd like to begin by introducing them. Glenda O'Hara is the patient coordinator for the Institute for Mental Health Research at the Royal Ottawa. It's a University of Ottawa institution. She will be followed by Cynthia Clark, who is the family coordinator for the Institute for Mental Health Research at the Royal again. Then we will be joined by Vidya Iyer, who is a professor at the University of McGill in Montreal, and she will speak to us from her perspective. And of course, you can probably read from their bios that they've got quite a long list of connections that will make this particularly interesting from their perspective. And the fourth speaker on our agenda for today is Florence Jarzynski. Now, she is the Executive Director for the Institute for Mental Health Research at the Royal Ottawa, and we're really pleased to have her along as well, and she will give her perspective as an executive for a mental health research hospital. So I think those are all really important things. So following their introductions, we were going asking you questions, and they will be in the form of a series of poll questions, just to get a sense of who you are, what your feelings are with regard to mental health research and mental health research policy. We'll take a look at that and see where that takes us. And then, as much as possible, we will be hoping to hear from you. This is your opportunity to ask questions, and certainly we'd like to hear back from you in terms of your own perspectives as well. So you have the opportunity, both, as you can see, to pose your questions through the meeting chat that you should be able to see. But also, as much as possible, I'm hoping that we can see some faces and hear some voices, because I've been on Zoom too long to just go by simply on chats. So this session will go on until 10:15. And unless I'm forgetting anything, why don't we just get started? And really pleased to see everyone here. There's some friends, I think, and I've gathered that some will be coming on at various points during the morning, and maybe passing on, and later on we'll be hearing from you. So with that, what I'd like to do is I'd like to turn this over to Glenda. And Glenda, thank you for joining us, and we'd like to get your perspective in terms of your role and your views in terms of mental health research, and mental health research policy. Your own perspectives. Thank you.
Okay, thank you. Well, I'm bringing the patient or client perspective to things today. And several years ago, I, like many clients, found research to be an elusive thing that was removed from my reality. You know, there were big announcements of millions of dollars for research while clients were struggling for access and programs, and it didn't make much sense. Attempts made to volunteer for research studies myself and my peers, we seem to always be screened out. So we wondered, was research really being done for the clients, and what to do about this? And, you know, if you hit a wall, you build a door. So our client advisory council decided we'd take the step to connect with research better. And we invited several researchers to present their research and answer our questions, opening that door for collaboration. We're going through a period of change at our hospital, and our CEO has been very bold and brave in the changes she wants to see: a more client and family-centered model, a hospital without walls, where silos are broken down, and clinicians, researchers, and fundraisers work together with a common goal to service the clients and families in the best way possible. I believe that researchers have become among the first at our hospital to follow the lead of our CEO. Days after the new strategic plan was introduced with its focus on clients and families, the president of the Research Institute reached out to the chairs of both the Client Advisory Council and Family Advisory Council to connect and share ideas on how we move forward, working shoulder to shoulder. This year, the Client and Family-Oriented Research Committee was found, co-chaired by a client and a family member, another example of research working with clients and families in a meaningful way. I sit on a leadership committee for the mood and anxiety program at the hospital, where every month I sit around the Zoom room with clinicians and management from that department, but also with a family member and a researcher. Research and client and family issues are on the agenda every month, a perfect example of silos being broken down and clinicians, researchers, clients, and families working together. Being part of this committee gives me the opportunity of seeing research being translated into care with the opening of our new esketamine clinic, an area that our researcher has spent a lot of her time. Sorry, I've lost my connection. I lost my connection. Am I back?
Yes, we can hear you and see you well.
Oh, good. I talked about the esketamine clinic, and researchers spent a lot of time with that, and now is using data from the clinic to help further the research in this area. I attend many committees, and I usually see research being represented. They're really making themselves available for collaboration. I attended a family information session recently, and one of our researchers was there speaking with families and caregivers in the evening about suicide prevention. At a recent fundraising event, story of lived experience were paired with young researchers who worked in the areas of lived expertise. That's a perfect example of research providing hope for clients and families. My wish is for more clients and families to be made aware of the good work done by researchers. Pre-COVID, when research was exhibited during Research Week, I would look out and find it unfortunate that researchers seem to be exhibiting for other researchers. In the future, it would be great to find ways to attract clients, families, and clinicians to connect with research being done. I urge you to keep connecting with families and clients so their voice is included in whatever you do. Last year, I was on an artificial intelligence framework committee, and we were doing polls throughout the meeting, and I noticed my answers were opposite to the rest of the committee, comprised of family members, management, researchers, consultants, and board members. After a while, I put up my hand and I said, just so you know, I'm the only client here, and my answers are opposite of yours. You always need the client's voice in the equation. So continue to engage us. As for me, I recently became a voting member of our hospital's IMHR Research Committee. I'm part of the committee working on the bipolar disorder education study that received a TRIC grant recently. I'll be a client representative on the Music and Health Research Institute's inaugural conference at the Royal next fall or winter. I'm also part of a research committee studying advocacy among social workers at the hospital, and will be part of the adjudication committee for next year's University Medical Research Fund grants. My favorite activity lately is participating in the Lived Experience Advisory Group, which will co-create an interview that aims to learn from people with lived experience of having a mental health diagnosis, in collaboration with the Norfolk and Suffolk Foundation in the UK. I just love these sessions with our colleagues from the UK and sharing our lived experience with one another. I look forward to many collaborations with research in the future. Thank you.
Thanks so much, Glenda. That was really very good way to start this off, about particularly the real human connection that needs to happen for health research, mental health research. So I think I'm going to expand on that a little bit and pass it on to a little slightly broader perspective, and that of the family experience. And so with that, we'd like to hear from Cynthia Clark. Over to you.
Well, thank you very much. I've known Glenda for quite some time now, and I'm always amazed at everything that she undertakes and everything she's involved in, and we're very, very lucky to have her. Well, from my perspective, integrating client and family-centered care, research, and innovation starts with a co-design strategy for achieving this goal. The Royal's new strat plan was developed shoulder to shoulder with clients and families, and it clearly supports the incorporation of client and family expertise into all of the hospital activities. This transformation would elevate the role that families and clients were already playing at the hospital to a more formal position, like a welcome seat at the table. There was a willingness to forge new partnerships which equally incorporated all the perspectives of the parties involved. As we've discovered, there can be challenges to moving the needle forward. At times, steps needed to be taken to find a solution to rising concerns. Change is never easy. There are some examples of how this collaborative model with the Royal has provided me opportunities to contribute to mental health research in the areas that I feel passionate about. In the summer of 2019, I asked Florence Dejensky if the Institute for Mental Health Research might support an application for funding to the CHIR's Strategy for Patient-Oriented Research Fund. We would be investigating advisor collaboration with service providers, specifically in the area of mental health and substance use disorders. Thanks to her enthusiastic response to my request and the support from all levels of staff at the Royal, the application for funding was submitted, accepted, and the funding was secured for research into building a framework for supporting meaningful family caregiver engagement. This collaborative, This collaborative relationship was innovative in many ways. For one, I was the principal investigator on the grant. And yes, I could provide the expertise that comes with 20 years of caregiver advisor leadership, but my background is not in research. This problem was solved with a guarantee that research expertise would be supplied by the Royal, with assistance in navigating through the bumps in the road ahead. And there were some. The principles of co-design and collaborative engagement were applied throughout every step of this research project. We were also received a financial contribution from the Royal's Foundation, and that supported the dissemination of the educational materials that came out of these research findings. The Royal's Communication Department assisted with the marketing of our knowledge products as well as a launch for our educational website. And the information about our research and copies of our products can be found at engagecaregivers.ca. And I hope you visit the site to have a look. The additional experience that I gained from this research partnership allowed me to make more informative contributions in my role as a family advisor. I have since provided a family voice for the following recent research initiatives: the Client and Family Working Group for the Research Council, and this is something Glenda mentioned, the Integrated Knowledge Transfer Working Group, which is so important because it helps people in the hospital to understand the importance of sharing their findings, their knowledge, and their expertise. The Nursing Research Committee, and this is made up of really dedicated nurses and staff that are trying really hard to integrate research into the nursing practice. And there's a somewhat unusual advisor opportunity that came my way through the Director of Practice Allied Health at the Professional Practice Allied Health at the Royal. I have joined her on a research team out of Carleton in Ottawa and the academics in a similar team in Australia. And we, like Glenda mentioned, we collaborate via Zoom, and this is always a scheduling nightmare because of the difference in times, but it's really worthwhile. The topic of this inquiry method of research is transformations in mental health social work. As well, this will be my second year that I participated on the adjudication committee for the University Medical Research Fund grant competition. And the inclusion of client and families into these grants is really a weighted criteria for funding. They take this very seriously. The principles that support these developing partnerships have now been built into the governance practices at the Royal. When I hear that a suggestion from a client or family member has led to a more positive experience for those receiving services at the Royal, I feel confident that over time, everyone will see the value in these collaborative relationships. To my knowledge, this value added has yet to be measured, and I think that would be a great idea for a future research project. Thank you.
Thanks very much, Cynthia. You brought some really interesting ideas to the table, and it's great to see how you're involved right up front in terms of the research design and the adjudication. So thank you very much from that. And I'd like to shift now to actually the academic perspective here. And I know, Vidya, you've got much more experience than just simply working out of a university, but I'd like to start with you and just give a sense from your vantage point and your experience, what your take is in terms of the trends, in terms of what you're seeing as even the future for mental health research in Canada. So over to you.
Thank you, Kevin. I'm so honored to be here today and really pleased actually to be speaking after Glenda and Cynthia, who eloquently highlighted the importance of grounding all that we do in mental health on lived experience. And I would say that this increased recognition that mental health innovation and transformation can only take place if we include and partner with patients, their families or carers and other stakeholders such as community members, elders or policymakers has been an important positive shift in the Canadian landscape and one that needs to continue being fostered. So why are we here early this morning discussing mental health? I thought that we could take a step back and look at why. Very simply put, I think there's been growing concerns about mental health in Canada. We've known for a while, so this is even before the pandemic, that approximately 1 in 5 Canadians will experience a mental health problem in any given year, and that a number of Canadians, like over 60% of Canadians who need mental health services, say that their needs are either not met at all or only partially met. So this is Statistics Canada data. We also know that some of these concerns are growing following the pandemic. So we're beginning to understand the data on the long-term impacts. So we still don't have definite answers, but what we do seem to be realizing is that the pandemic has had some complex and negative impacts that have persisted on mental health and substance use of the Canadian population. We also know that not everyone is affected equally with respect to the pandemic impacts or mental health mental health problems in general. So young people, those who are unemployed, those who are poor, those who identify as LGBTQ2S plus seem to be particularly impacted. Now, I don't want to paint only a grim picture. In fact, I would say that there have been many, many areas where there have been lots of tangible and exciting progress in mental health across Canada. And these really point a way forward and inspire optimism that more is possible. So the first thing I would say is that particularly after the pandemic, there's been an incredible increase in the awareness of mental health, the importance of mental health, and almost like a never before seen level of agreement across sections of society that we need to invest in mental health services, policy, and research. The second thing I would say that in Canada, like federal government, provincial governments, territorial governments, services, communities, philanthropy, the private sector have increasingly been addressing mental health and well-being priorities and often partnering together to do so. In fact, in the fall of 2021, for the first time, Canada created a new position of Minister of Mental Health and Addictions, which I think was quite interesting and provided a source of hope for many people. Another important shift, positive shift, is that our understandings and our solutions that are being proposed increasingly acknowledge the importance of social determinants, the importance of equity, diversity, inclusion, and justice, the importance of how intergenerational trauma and their ongoing impacts on Indigenous mental health and well-being, and of simply ensuring that when we think about mental health, we're also thinking about larger issues like the climate crisis, economic hardships, etc. We have amazing transformations following the pandemic in e-mental health and digital mental health. Canada is also increasingly emerging as a global leader in youth mental health services reform and integrated youth services. And this is important because we know that most mental health problems start before the age of 25, and that so much of what we consider important in life also happens in youth, such as finishing school, starting work, and so on. Fortunately, I think what we've learned, and this has been the bulk of my own work, including through a large project called Access, which was funded by CIHR under the Strategy for Patient-Oriented Research, which actually took place in 16 diverse communities across Canada. We know from work like this, so this project called Access and other projects, that it is possible to improve access to youth-friendly mental health services and supports, that this can be done in a way that is culturally and contextually sensitive, and that is evidence-informed if you partner with patients, families, and community partners, and that investing in early intervention is effective in improving outcomes, and it is also economical. Two other sort of important shifts have been the increasing importance of Indigenous leadership and self-determination in developing and implementing mental health and wellness strategies. Another important shift is that we're increasingly prioritizing, and I think this is really important, a learning health system idea, which is that we're not a static system. We're continuously collecting information, data, stories, numbers, and then learning from these numbers in real time to try and further improve services and what we provide patients and families. Now, while all of this is cause for much hope, lots more needs to be done, and done urgently, to address pressing issues such as long wait times, lots of geographic and demographic inequity and variations in mental health access and outcomes, a growing concern that there is a healthcare workforce crisis. So how do we diversify the workforce? How do we expand the workforce? How do we regulate while ensuring that we also make space for lived experience, peer support, and cultural knowledge-based workforce? Overall, two last messages that I would like to leave us with. One, that we have a no-do gap in mental health, which we need to find the innovations and creative ways to address, which is we're putting into practice only a little bit of what we know works. So how do we do better on that front? And the second is that Canada is still well behind other countries in terms of how much of the healthcare and research budget is allocated to mental health. And this does not match the disease burden and the disability that is accountable to mental health problems and the costs to people, families, and the Canadian economy. So we really need to continue advocating for increased investments in mental health research, services, and policy. Thank you.
Thank you very much, Vidya. That's in some ways really encouraging to hear what you've been saying about how we've been making progress over the last, but it sounds to me as well that there's still a lot more to do, and this is going to be an ongoing issue, not just for some of us, but I think for all of Canadian society. So thank you for that. Our last speaker in terms of this first part, and certainly not the least, is Florence Jasinski. Now, as I mentioned before, Florence is the executive director, president, of the Institute for Mental Health Research at the Royal Ottawa and the University of Ottawa. And I guess full disclosure here, I actually was invited to sit on the research committee for this organization, and that's one of the reasons I felt it was so important to have it highlighted today at the CSPC. So over to you, Florence, and I'd like to get your perspective on the mental health research situation in Canada.
Thanks ever so much, Kevin, and good morning. Bonjour à toutes et à tous. It's really a pleasure to be here today. You've heard it from Cynthia and Glenda. We couldn't do it without you. And, you've heard it from Vidya. Mental health and substance use health is in a crisis, an epidemic made worse by an epidemic, but there is hope. So, we know there's close to half of Ontario residents who have unmet or undermet needs. And at the same time, our understanding of mental health still has significant holes. We don't, for example, have precise diagnostic tools for mental health. There's no blood test to diagnose mental health, and we can't really access the brain easily. And also, we have to say it, stigma has put our understanding of the brain far behind other parts of our body. And so we have both unmet and increasing demands and lots to learn. And yet mental health research worldwide is still chronically underfunded compared to other disease areas. We know that in Canada, and Vidya has said it, we spend far below OECD levels on research and development dollars per capita. CIHR is Canada's largest contributor to mental health research. It was reported that CIHR spends 4.3% of its annual budget on mental health. And so that was back in 2018, around $47 million. If we compare to the situation in the States with the National Institute of Mental Health, so that is the lead US agency for research and mental disorder, their budget is around $2 billion. So you can see that in addition to the fact that we've been known in Canada to spread a very small part of money to many, many talented researchers who want to make a difference. So, of course, that certainly impacts our research ambition, and it's sometimes difficult to shoot for the stars. But we do have talent, and we do what we can to make dollars go further for those who suffer from mental illness and generate hope. One of the more efficient ways to stretch those dollars is through research hospitals. And we're speaking here from the Royal in Ottawa. And through the Royal's Institute of Mental Health Research, our goal is to create a patient-centered approach that provides access to care through research. I'm sure you gathered that from Cynthia's and Glenda's conversation. We are guided by three principles: engagement, access, and precision. From an engagement perspective, we create multidisciplinary teams of researchers, clinicians, clients and families, and healthcare professionals. They're working together to untangle the complex biology of the brain, design novel approaches to prevention, diagnosis, and treatment, and to provide access to care through cutting-edge research. Critical in that list of participants, as you know, is the client and their loved ones. They are expert in their own lived experience. Putting them out of their care is both necessary and empowering. And it also reduces stigma, improving engagement. So our ambition is that every client is invited to participate in research. That option creates hope for many clients for whom traditional approaches may not have worked. The second principle I want you to discuss today is access. Recognizing that our health system is under immense capacity and funding strain, and that mental health support is even more inadequate. So the model at the Royal is that we create access to care through research. And because the research you do is cutting edge, from neuromodulation, brain imaging in multimodal approaches, we provide access to care that would not otherwise be available. Our clients have access to new technology, new approaches to care with measurable results. So the third principle is precision. It's important to think that mental illnesses are complex. They are multi-parameter, they are first-person experience condition. And really, our goal is to put the person at the center of their treatment, including their biological, psychological, social, and spiritual selves. So I'm just going to jump, given the time we're having, is that just to say that every client deserves to have a treatment plan that is customized to their condition and need experience. Given what we just talked about, how can we progress toward more personalized approaches to treatment? Addressing the whole person, using multimodal approaches empowered by AI and big data to progress and leverage computational psychiatry, but also integrating the 3P principle that Tom Insel speaks to in his recent book, Healing: People, Place, Purpose, both for prevention and recovery. I'll just finish by saying that this model of creating access to care through research is not a new one, but it's not the norm in Canada and it's not well understood. Research within hospitals are subject to different constraints compared to those in universities, as you know. For example, we do not have big budget for scientist salaries and we can't use grants. So we rely really on philanthropy to basically support our scientists to carry out that cutting edge research. So, all in all, we believe that developing research in hospital settings, creating multidisciplinary teams that care for the whole person, provides the best care possible for our friends and families. But as a country, we have a little bit of work to do to reimaging the system for funding research and care for mental health in an integrated manner, recognizing obviously the outsized impacts that mental health has on our society. So I'll stop there. Thank you very much. I look forward to hearing from you.
Well, thank you. Thank you very much, Florence. And I think that's a great way to end up this first part of the session, which really gives a broad perspective from the point of view of the patient, the family, the academician, and of someone who, like yourself, who is actually running a hospital institution in that kind of an environment. And it's very encouraging to see the approaches that are being tried, and certainly there's a lot more to do. So thank you again so much for that. Now, I'd like to shift right now to asking you some questions, and I hope you don't mind. These, of course, will be in a series of polls. We want to get a sense, first of all, about your own views and your own experience a little bit in terms of mental health research and mental health itself, and also take a look at what are the, so there'll be a series of 3 polls. So this is poll number 1 that you see in front of you. And I'll just read it out for you, and then you just get a sense. Before we do so, I just want to make sure that you all understand that this is totally anonymous. So anything that you're putting in here will not be shared beyond just the aggregate knowledge, and certainly it's something that you should be all sure of. So with that, I'll give us a couple of minutes to see how we're doing here. So they're very good. So if you take a couple of seconds and take a look and can answer these questions. How many participants have experienced themselves a mental health issue? how many participants know of a family member who has experienced a mental health issue? And the third question is, how many participants know of a friend or a colleague who has experienced a mental health issue?
So you should see
So-
the results for the first poll now.
Okay, so how many, I think we have pretty much everyone has answered these questions.
85% yes.
That's good. Well, interesting, isn't that? So first question, I don't think I can see the bottom part, but certainly this is obviously a question that's close to many of you here, either personally. So we have 82% of participants actually saying that yes, they have experienced it, and 100%. Isn't that important? Have a family member that has experienced a mental health issue. And I'm not so sure I can see further down. Can I see further down for the answer to the third question?
Yeah, just maximize the window and the
Oh,
third
right.
is also
That's all I need to do. Very good. Well, yeah. So I think that this is in some ways not self-evident, but I think it does confirm the fact that this is close to all of us as individuals and as participants in our own societies. So with that, thank you very much. We have a second poll, and just to get a sense of your where you're coming from, if you like. And so would you mind posting the second one? So the participants here, how many of you are involved?
Right?
Can you
It's not
see
a
this?
hospital day?
Yeah.
Okay, don't leave. I need to give you something.
Okay, so how many participants are involved in mental health research themselves? Are you involved in mental health programming or delivery? Are you involved in mental health policy? Are you involved in health research funding? Or are you involved in mental health advocacy? Clearly, these are not, so you can answer all 5 of them if that's the case, or 1 or 2 or none if that's in fact the case. So let's see if we have any responses here.
You should see the results now.
Yes, I can. Okay, so there are some people here involved in mental health research. That's great to know. I think it's just as important to know that some that are not, and the same goes with programming and delivery. So this is really important to understand, and we're glad that you're joining us for those that have not, or in mental health research policy. So what I'm taking from this is that there's some direct experience in one form or another, but a number of you there really are approaching this, I guess you could say, from a lay perspective, but certainly from a personal interest perspective. Great. So our third poll is much more about where we're going and what you think should be done. Again, whether from your own personal views or whether or not you have particular interest. And so this one is a priority setting one. So imagine if Canada could set itself some goals related to mental health that would then guide research, policy, and health decisions. So of the goals below, which one would you most strongly support? So it's a single choice. Choice number 1, reduce the number of Canadians experiencing mental health problems through effective mental health promotion and prevention. 2, improve Canadians' choice of and access to existing mental health care and supports. 3, increase our knowledge of the causes, biological, psychosocial, social, and mental illnesses by investing in research on causes and risk factors. 4, increasing the number of new and improved treatments and supports for mental health problems. And finally, reduce the important equity gaps related to being Indigenous, racialized, an immigrant, or LGBTQ plus in access to mental health and care and supports. So pick one, and we'll see what this gives us.
And we'll allow 10 more seconds on the poll.
This is a tougher one, I think. Interesting. So we're seeing a fairly equal split, although I'm seeing from this, and again, the statistical significance of it maybe is just more of a sense of who we are in the room. But what I can see, improving Canadians' choice and access to mental health care and support, and increasing the number of new and improved treatments that support for mental health problems. These are ones that seem to be of particular interest to those of you. Increased knowledge of the causes, as well as reducing the important equity gaps addressed. And finally, reducing the number of Canadians experience mental health programs through effective mental health promotion and prevention. Of course, all of these, I think, are important parts of the way forward. And I'm sure that there are others, but it is in a sense that there are certainly a number of avenues that need to be explored and improved upon if we want to get to address these questions that I think are close to all of us. So with that, I'd like to shift to the third part of the session. So I'm going to close this, because I need to close this, and open it up to you. So we have a fair amount of time, I hope, for you to ask questions. Et en passant, si vous avez des questions en français, on vous invite de les faire dans la langue officielle de votre choix. Certainly, we can start off by asking some of the questions through chat box. But as I said earlier before, I think raising your hand and actually asking the question out loud would be great, just to see what you have in mind. So with that, I see Masha. Good to see you,
Hi,
Masha.
thank you very much for this presentation. It was a pleasure, and thank you for CSPC for having this important topic addressed at the conference. In the night times, sometimes I volunteer as a crisis responder with Distress Center of Ottawa and Region, and I'm also sitting on their board right now. And what I hear from people who call in distress, usually with some mental health issues, is just kind of the lack of social supports, and what a aggravating thing it can be to people, with existing mental health conditions, or can, promote that. I was wondering how big of a role you see that kind of in your work, in your advocacy, how important of a, precondition you see kind of having a larger kind of social safety net for people in addressing their mental health issues, both from the patient, from research, from the hospital perspective. Thank you.
I think that's an open question for who wants to take that on first. No, don't be shy.
Maybe I can
Lydia.
address it. Oh, okay, great. There's volunteers already.
Yeah. should I go?
Yeah, go
first?
ahead, please.
Sure, and then I'm happy to hear everyone else's perspective too. It's an excellent question, Masha, and certainly there's years of evidence highlighting the links between social support and mental health. So for instance, we know when it comes to young people, whether or not you have at least one reliable adult in your life seems to really predict the likelihood that you might be more vulnerable to mental health and substance use problems. So really, like, social support and family networks are really, really important. We also know that particularly in the pandemic, it was an unfortunate kind of natural experiment that showed how social isolation and loneliness can really be disruptive in terms of mental health and substance use. We also know that with digital, on the one hand, it provides one form of increased global connection, but on the other hand, it also is increasing isolation. Like in mental health, there are multiple attempts in terms of services to try and increase the depth and breadth of networks for people who are suffering from mental health problems. So these include, family connecting, strengthening connections with family. There's also some really interesting work including in Ontario, around social prescribing. So the idea of actually prescribing social activities as a way, as an intervention. And this can be done by your family doctor. There's really nice evidence for social prescribing. In cultural communities and Indigenous communities, there's been a strong appreciation for a long time that this connectedness, including intergenerational connection, is really, really important to foster for mental health and well-being. I mean, I hope that gives you a little bit of flavor of like that this is something that I think is we can do more. And when it comes to the elderly, the last thing I want to say is that there are some really cool sort of studies going on trying to match elderly people who might be experiencing loneliness and isolation and young people in urban contexts who are often unconnected and might be finding it difficult to find housing, to kind of have experiments to see if matching these can provide solutions to address multiple needs at once.
Thank you. Yes, the loneliness, I hear a lot of that. Loneliness, supportedness kind of in the community. And then the results, lack of housing, etc., and other social supports that are kind of more on the local.
Florence, I think you raised your hand.
Yes, I wanted to thank Masha for this question. It's really largely the crux of the matter in terms of loneliness and impact on mental health and substance use health. I'll just go back to something I mentioned earlier around the term that Tom Insel recently coined around mental health. Dealing with the mental health crisis is around people, place, and purpose, and highlighting the fact that although there are available treatment for mental health, because of the dimension of access and precision and engagement, we're finding ourselves in difficult situations. But there are concepts such as that have been evaluated and shown the meaningful impact of clubhouses, for instance, where an environment is built around an individual and have an incredible impact in the lives of people.
Good. Glenda, Cynthia.
Okay.
I don't think I'm hearing you right now. It looks like your mute is off, but try again. No. Try again. Try one more time.
Can you hear me now?
Yes.
Okay. I don't know
I'm
what
so
happened.
glad that didn't happen when
Well,
you
I kept hitting the unmute button, but it didn't. Anyway, I'm talking. So I'm so glad you mentioned this, because I think that we really don't. We have to do more measuring of the impact of human connection on this very vulnerable population. Because I live with someone who has schizophrenia, and I've done a lot of work with clients. I ran a program, and the major problem I saw on a day-to-day basis was their lack of social interaction. And during COVID, the ones that there were set up some support groups or activities, or they had these in place, they lost them. And some of them suffered terribly and relapsed in all kinds of really negative consequences to that. So, and it's so important, and the family usually tries to fill in, or if the family is a really big part of their life, they try to fill those gaps, but they can't really. And so I think if there's a lot more attention that needs to be paid and funding to making these supports available to our population.
Thank you. Glenda, anything from your point of view?
Well, support is, I'm a peer facilitator of a recovery program, and support is one of the 5 key concepts of the recovery journey, and it's so important. And at the beginning of your journey with mental health, it may seem really daunting to connect with some supports, but it's really, really, really important, and it can be in so many forms. Like here in Ottawa, our mental health community has some wonderful community groups that can get people connected with similar lived experience and provide some peer support, which is one of the best supports of all, peer support, because we're on a level playing field. We have a similar lived experience. So it's very important.
Thank you. Thank you very much. Before I go on to the next question, Florence, and I think of some others, but Florence, you made reference, I think, earlier as well to Tom Insel in his book about people, place, and purpose. I don't know if you can find that, but I think that would be something that I've read myself, and I think there would be people would be very interested in. I don't know if you can find it on your web, but maybe post it to the chat line, at least a link to it, because I think that's one piece that I think would be of interest to many of us. And I'm going to pass to the next question, and I hope I get your name right because I can't read it. Is it Jonato?
Yes, it's Jonato, John Paul.
Jonato, nice to meet you.
Yeah. My question is that most often what happens in research is that some groups are over-researched, and some vulnerable groups are over-researched because we just keep researching about them over and over, and they become angry that they're not even benefiting from this research. My question, how are we making sure that there's no competition among researchers to recruit this vulnerable group and their families, and to prevent participants being over-research?
Important question. Florence, you can start off.
Thank you for such an important and really crucial question. Earlier today, we spent quite a bit of time talking about meaningful engagement of our clients and family in the research development process. And I think this is critical to ensure the responsible conduct of research with an EDI lens, because we meaningfully integrate the feedback of our clients and family into that research design. So that co-design, that meaningful partnership is a crucial aspect to me.
Cynthia.
I think one of the things that I hope that research funders recognize is that the research should also speak to the people who are being researched. So if there is, it's too bad there isn't more of an understanding of going to the people that are receiving the services and receiving the help and asking them, well, what topics are important to you, or where do you think the research should be undertaken? And if you do that, you have passionate people that want to be involved, because this is the things that really matter to them, not some of the research that just really matters to other people in the medical profession, say. So I think the key to this is to maybe look to those people who have a vested interest in the research and say, how can we collaborate with you on in something that's important to you to find out about?
Vidya, I'm sure that you've had some experience or have seen some examples of these kinds of issues.
Certainly, I think that we need to make sure that this patient involvement or family involvement in research is guided by strong ethical and values based frameworks, so that it's not only extractive, so it's not only to benefit the researcher, but that we're really thinking about how does it benefit patients who are participating, families who are participating. And it's the same when it comes to communities as well. So when a researcher goes into, for instance, an indigenous community, like, is this benefiting only the researcher's career, or is it really about what are the priorities, preferences, who owns the data, what is it being used for? I will say that this has certainly become, we have miles to go, but in the last 5 or 6 years, there's been an increasing ways of thinking, how do we do this and how do we do this well? And who needs to be at the table? And part of what can help is from the beginning ensuring that those who we are accountable to are part of the planning and dissemination committee. I think that they then provide these accountability checks and setting up sort of structures that address some of these inherent kind of power imbalances that have been there traditionally. That's an excellent question.
And a crucially important one, because at the end of the day, it is about people, right? And people that are in vulnerable positions. So thank you very much for that. And Glenda, unless you have a point, I certainly don't see any questions on the chat as of yet, but others certainly, please raise your hand if you do. I've got tons of questions, but I could monopolize the rest of the time that we have left by pointing to them. So just give a second. Yes, Donato, please.
Yeah, I do want to do a follow-up question. You mentioned ethics, strong ethics. And I mean, one of the problem in academia is that sometimes it takes forever to get the ethics approval. And sometimes you have to do multiple ethics, hospital ethics, academic ethics. And if you are going to a community, sometimes you have to do ethics too. By the time you complete all those ethical things, sometimes the research may become redundant because other people may have done it already. So then, so how are you going to balance that? That is my question.
So it's actually a very good question. And one of the things that I will give you as an example of how we're balancing that is we're actually now doing more and more research that is really reducing this cycle of learning, doing, studying, and acting. So the idea, for instance, in work like learning health systems is that we really don't want to have something happening in the real world, something happening in the academic world, and then the academic world studies the real world, and then it takes another 5, 10, 15, 20 years to take what we've learned in the research world to implement. Instead, what we are creating is these quick cycles where people are getting together, clinicians, researchers, patients, families, and quickly identifying priorities, collecting data, learning from the data, changing something right away in the system, seeing if it works. So if you create ethics around this sort of a framework, so if you get ethics approval inherently for this sort of idea of a cycle, from the beginning, it means that you're not getting ethics for multiple mini projects, but you're actually getting ethics for this sort of a framework that seems to do well in terms of bridging this no-do gap and the gap that you're talking about. How do we create knowledge in a way that can actually address real-time priorities and coming in so late that it can't really impact systems and policies. I'm sure others have some, I don't know if Florence, Cynthia, Glenda,
Yeah.
if you...
Please, and I think even Cynthia, I know you may have seen this yourself in some of the reviews that you've done, but Florence, over to you.
Thanks, Giving, and thanks for these great questions. I'll give you my perspective from an institutional perspective as someone who runs a research institute and supports a research ethics board. And for us, it's really about creating the best possible environment for research to thrive and to support that research so that we can develop from bench to society. As one example, if we are thinking about a project that is co-led by one of our Indigenous partners here in Ottawa, the thinking is around developing and submitting your REB submissions together in a meaningful partnership so that the questions, of course, that the Research Ethics Board are going to have already been addressed because the partner is at the table. And then another food for thought area is around collaboration between institutions and finding harmonization processes in order to support that research environment to thrive. So, that's about agreements between organizations as well.
Good. Unless there's any other comments immediately, I'll pass it on to Kellyanne. Over to you.
Thanks, Kevin. It's been a really interesting talk. I was interested maybe in hearing a little bit from either Glenda or Cynthia about their experience on the adjudication panels as a patient or a client, and how you how that went and your thoughts on it.
I can speak to that. I did do it last year. It was interesting. It was a learning journey for both myself and those on the panel because it was the first year. So there were a few bumps in the road at the beginning, but what I found very interesting was how important, what a big emphasis there was on client and family centered care in the applications. And there was, this was new to some of the applicants because you could see some of them were really had clients and families at the beginning co-designing the research and involved in all the steps and we're going to play a big part in the review process and et cetera. And then others kind of just didn't know how to get them in there, like it was you could tell that this was not something they had thought had been well thought out by them or even how to do it. So I guess that, as time goes on, those people will probably have a better understanding or make more of an effort to co-design and conclude at every step of the process. And I think that's going to be really, really helpful for their research and make it a much more meaningful experience for them as well, to see how they could do things better when undertaking research with patients and clients and families. So it was new, and what we have come out of it. I worked with some of the participants in the research institute to develop a manual, a how-to manual of the expectations for doing this when clients and families participate. And I think that's going to be really helpful because I have had this experience with the research that I've conducted with the Royal, but there'll be a lot of advisors coming behind me who haven't had this experience. And it would really help to prepare them and help to understand what their role is in this adjudication team.
That's really interesting about the manual. I'm wondering if that is something that's publicly available that could be shared, or if it's if it's private to the institute.
You'll have to ask Florence this.
Happy to share.
That would be wonderful. Thank you.
Sure, and I don't know if we have time right now if we can do this, but certainly, Kellyanne, you feel free to follow up directly with Florence, and I'm sure all of you may want to pursue this. I've noticed that Daniela made a point here. I'll read it, but Daniela, certainly feel free to comment yourself. Maybe we should increase the level of trust on researchers following the ARCSIV movement. I'm not familiar with that, but I suspect others are. Trusting the researcher, the partnership instead of the project. I think that's fantastic perspective and a very important one. A silly question: what is the ARVIX movement? I think the main point there, nevertheless. Oh, no mic. Okay, no problem, Daniela, but. Something for me to look up. Yes, Cynthia.
When it boils down to it, doesn't it just come to people?
Absolutely.
There are people that are really willing, like Florence has made huge advancements in this area because of who she is and her commitment to it. And there's a lot of other people at the Royal that have done the same. And I think, they'll bring the others along over time when they see how wonderful this is working and how beneficial it is. So, but it always takes those champions to actually make something happen. So I'm hoping that some of the people that are on this webinar today will be champions in this area.
Wonderful, and certainly you're hitting the nail on the head. I think really it is so important that at the end of the day, it is about people and helping people that are in vulnerable and situations. And I think that's what we're all here for. And it's so easy to lose, perspective at times when you're in the midst of, your own world or your own experience of either doing the research yourself or writing policy. You get caught up in it, but as we saw from earlier, just in the poll questions, absolutely everyone around the table here has had some direct experience, and it's so emotional. And I think as much as any other subject that we have, it's so critical. I'm aware that we only have 5 minutes, as you see, to the end of this session. Are there any final questions that you'd like to raise? I'm going to do a real quick one, and it's going to I'll put you all on the spot. But Florence, my question to all of you is, if you had one thing that you would like to accomplish in the coming year that you think would be really impactful in terms of your role or what the institutions could do, what would it be? And if you don't have an immediate answer, that's okay. I know that I'm putting you on the spot.
Thanks, Kevin. And I'm trying to pick from the list of all the things, we have on the go and that we're trying to do. But I think, we are in the process of building really meaningful connection with community partners. I would really, really like to see that to come to fruition. The mental health system is a mosaic. It's a complex system, if we're thinking about the continuum of care. So if we can make a contribution there and continue our advocacy activities for considering that research is care and that the integration of research and care benefits our clients and family and our society.
Okay, quick over to you, Lydia.
I think that what I look forward to is sort of figuring out how research reform and partnership can be sequential and synergistic so that we can really bridge the gaps between these three things that sometimes operate in silos. So how can we do this research reform and partnership? I need an R word for that, synergistically and sequentially, so that we can in real time keep strengthening connection and partnership.
Building off each other, yeah.
Yeah, building off each other. And how do we do that and reduce these feedback loops, the time they take?
Great. Cynthia, quick one for you. I know that we're running down.
Oh, I just would like to see more funding coming our way so we can
Nice.
do more research. I want
Good for-
money.
Okay, good. Glenda.
I was really happy to hear about the manual. We're, really pushing client and family involvement more. And I see it improving over the last few years, but, sometimes there are administrators or researchers, they have this client and family there, and they really don't know what to do with them. So I think, education of how to include us and how we seek out these collaborations, those things would be great to look at in the future.
Thank you. Thank you for all four of you. I think you've been fantastic. I've really enjoyed this, not just today, by the way. I've enjoyed over the last couple of months preparing for this. I've learned so much and have so much respect for what you're trying to do to accomplish. It's so important for all of us. I realize that we have another session coming up and there may be people already trying to log into that, but thank you again so much. It's been a remarkable hour and 15 minutes, and I'm certainly glad that for those of you that have joined us, that you've learned something or found something of real interest. I'd encourage you, there is a feedback session or feedback that you'll be sent after this. We'd like to hear from you about what you thought, what could be better, and what you took away. So with that, thank you. And I want to thank the organizers of this. They're the untold, I guess, the people behind the scenes that have made this such a success. So here we go. Your last question.
And thank you, Kevin, for spearheading and supporting us throughout this process.
It's been a pleasure.